Today is our fourth episode of Boundary Breakers. Thank you, everyone, for coming. We are with the lovely Dr. Farah today. Say hi.
Hello, everybody. This is Dr. Farah Shroff. I hope you're doing great.
Yeah, I hope everybody's doing great out there. Hopefully, everyone's staying warm with Canadian weather going on. I bet it's cold in other parts of the world too, but that's predominantly where we are. Today, you'll be joining LC for an exclusive interview with Dr. Farah, an accomplished educator, global health advocate, and public health expert. We will be delving into her diverse experiences from being Takemi fellow at Harvard and her impactful work that she's done in India, Guatemala, and Nigeria. We'll be exploring her role as an associate professor at UBC, a principal of consulting, and we're also going to be looking into her pioneer research, writing, facilitation, and realms in public health, education, and social issues. Our theme for today is holistic health and social justice, where we'll be unveiling insights in global health well-being, women's empowerment, and health for all. Did you want to tell the audience a quick thing about yourself, Dr. Farah?
I absolutely love trying to make the world a healthier place. That is what I've dedicated my life to doing.
Perfect. I'll be representing our LC team here today. My name is Piper, and I am an Alberta Calgary student. So I know a different area of Canada, and I'm thankful to be here today. Let's get right into some questions. Dr. Farah, how has your work in global health allowed you to build meaningful connections within diverse communities worldwide?
My work around the world has given me a window into so many different communities and places where I have to tell you, I love to go somewhere where I've never smelled those smells, never seen those sights, never heard those sounds. And so my work has allowed me to make new friends, make new colleagues, and to get a window into a way of thinking that is really fresh and different for me. From deep inside the jungles of southern Mexico to rural areas in Kenya. I was born in Kenya, to many parts of India where my parents were born, where I've worked, to Argentina, Costa Rica, places I've been just very recently, to the high Arctic in Canada, the Yukon, NWT, and Nunavut, where I've worked. I feel like I have this beautiful family of new friends and connections. And really, the basis of all good work, and maybe the basis of life itself, is relationships. So that's what these adventures have afforded me, is beautiful relationships.
I agree. And in some of our past episodes, some of our guest stars have talked about how creating connections across the world is so meaningful to them. So, how do you think is the best way to go about creating these meaningful connections with people all over the world?
Be yourself. Know who you are and be that person. Particularly in working with communities who have experienced colonialism and racism, and they're not going to trust you. They don't want to talk to you. They think you're a potentially dangerous person to them. And the only way to work with people in those circumstances is to genuinely know who you are and to be that person in an authentic way. And I would never have been able to do the work I've done if I hadn't been able to do that. And it's very much true here in Canada. I can tell you, I had just finished my undergrad in biology and Indigenous studies, and I got this grant, and I was working up north. I was in a clavic, and then after the grant, I got a job working for the government doing health research. And at that point, I was trying to reach one of the chiefs, because you really can't do a lot of good work in communities unless you talk to the chief. So I contacted the band office and I said that I was working for the government, and I was doing the study on the impact of the oil and gas industry on the health of Arctic villages. And so the chief said, well, I'm really busy right now, but I have to do my laundry on Saturday at 10 o'clock. Why don't you show up at my house at 10 o'clock on Saturday and you can fold laundry with me? So I said, sure, I'll be there, chief. And so she didn't have any time to waste. This woman was busy. And it was like some dumb new government person who'd come from the south.
Yeah.
And it was like, as long as she got her laundry done, this was going to be okay. So, so I folded laundry with her. I probably spent about 4 or 5 hours with her because after the laundry, she had other chores to do.
Oh my gosh. I was going to say that's a lot of laundry to do in 4 hours.
Well, she had a large family. And she was pretty meticulous about her folding. And so, and she made sure I folded it well too. But by the end of the 4 or 5 hours, she got a sense of who I was. And that was the important thing for her. It was like, could she trust me? Was I there just as another agent of a government that had never really done much good for people? And was I just out to get information and do nothing helpful with it? Or was I genuinely interested in seeing Indigenous people's health improve? And so, so she wouldn't have done anything for me if she hadn't been able to trust me. And that was the way that she chose to do it. And if I hadn't been willing to put in a Saturday
at work, yeah.
I mean, whatever my plans were that Saturday, I canceled them. And so I can tell you a gazillion stories like that, where the relationships have really been developed in a kind of a fun and perhaps unorthodox way.
I think the use of unorthodox is the best way to go about making meaningful connections, because if you are just going to be very surface level, people aren't going to have that recollection of trust that you were mentioning. And just speaking with you in this short time that we have been so far, I can already tell so much about your personality, and I can see why you wanted to be involved in healthcare and just creating a bigger difference in people's lives. And that's our main goal here at LC and that's what we do. So I think it's really awesome that we're here sharing these experiences today. And yeah, I haven't traveled the world like you have, so I can only hope that I'll have some meaningful connections like that with people from all these different places. But I think that's a pretty funny story. It's definitely something memorable that's going to stick with obviously you and everyone watching here today.
Thank you. I hope you do get a chance to live your dreams, whatever they are. If your dreams are about travel, I hope that they come to you.
For me, I think dreams definitely come. Hopefully they don't go unless they come first. But I think they build over time, some people have dreams they have from the time they're kids that they have until, that they're seniors and whatnot. But people grow and change. And I think your aspirations will grow and change with you.
I have lots of dreams. Just for 2024, I have dreams for myself.
What are some dreams that you have for 2024?
Oh, okay. Well, I'll tell you. Well, this year, I'm really trying. This is a huge thing because, as you might have guessed about me, I'm a professional. I'm a mother. I'm a family member. I travel for adventure, but that's why partly it's become my profession as well, because I love adventure. And I've been a very competitive athlete most of my life. I now teach yoga and dance, and I teach martial arts and a whole pile of things, but I typically never stop. Like I'm really like just constantly going. And so what I've set for myself for the year 2024, the year of the dragon, is RPR, rest, pause, and reset. To have a whole different way of thinking than I've had now, and that's a huge tall order for me actually. But to try to think that sometimes it's in the stopping and the pausing that a lot of good things happen. And I teach that in my yoga classes. I teach my yoga students. Sometimes I've devoted whole classes to pause, to the pause. And so I do it, that 1 hour when I do yoga every day. But now I'm trying to really just take that whole calmer, zenner approach to my year, and just see how maybe so much racing around just for this year, let's see how it goes, will be just as productive, just as exciting, and and just to see if I get a little bit more sleep, if it'll be better for me.
That's what they say. You do like your sleep causes you to mentally keep working on what you were working on. So even taking that moment to just allow yourself to have a better rest is going to do you more service than it would disservice. And I don't know if you'd know this, but I am also a dance teacher. And even you could take that aspect of pause and stopping into even choreography. What is a dance that is constantly never stopping, all the same erratic nature? And then how shocking would it be just to freeze? It creates more impact, allows people to think about what you're doing, allows people to feel. So if we take that and project that into your whole life, then it allows for things to build, things to develop, and allows you to think more rather than to keep constantly on the go, right?
Absolutely, because some of the most like important dance choreography is when you are just stopping for a moment, right?
Yeah.
Yeah.
A lot of the time it's even called strike. And it's not just because you're striking it so sharp, it's because it's striking. You want to make the audience feel something. That's why dance is such a unique form of art. My favorite form of art. I love all arts, but obviously your personal passion's what's gonna drive you the most, right?
I'm with you about the dance though. Yeah. In yoga, sometimes we ask ourselves this very deep question. Who are you? We do it just before we're going to go into Shavasana, which is that really quiet place. And if you just plunk in the question, who are you? It's really interesting because usually what we say is take the first answer that comes.
Mm-hmm.
And one time when I asked myself the question, the answer was a joyous dancer.
Oh,
How was it?
I love that. I don't even know how I would answer that question because now I'm thinking about it. I think that
Yeah.
immediate gut feeling is
Yeah.
where you're going to get the real answers from. So you'd have to ask me off my guard, I guess.
Or just before you're going to do something really like just, that sweet place where you're going to go into a deep relaxation. That's when you get the answer. Not when the brain is too involved. Yeah.
No, 100%. Just that guttural feeling that immediately happens. I totally can see the pathways that's going to lead to. I haven't been able to take my eyes off your shirt. What is this fantastic sweater you are wearing?
Oh, this is from Argentina, where I was about a year ago. Yeah, handmade by the indigenous woman we bought it from.
Mhm.
I absolutely love it. Yeah, it's from the northern part of Argentina called Hui Hui.
Oh, well,
Yeah.
it's absolutely gorgeous. What are these little
Llamas?
they're llamas. Yes.
Yeah.
I love that. I was wondering if it was like someone farming and another person holding up the sky. I wasn't sure.
Oh yeah, I'll show it to you a little bit closer.
Oh, I love that.
See the little llamas?
That's
Yeah,
gorgeous.
thank you. I
I'm
fell
gonna
in
have to,
love with it too.
I'm gonna have to get me one of those. I'm a big clothing lover, definitely.
Right? The soft feeling of them. Yes.
Especially in your travels, we've talked about how it's a foundational part of your career to be visiting all these different places all over the world. In what ways have these projects fostered a sense of community, inclusivity, and diversity, both globally and potentially locally?
I would hope that almost everything that I do fosters a sense of community, diversity, and what was the last word that you used?
Inclusivity.
Inclusivity. Yeah. So I hope that every class that I teach, a yoga class and a medical school class, I teach medical students at UBC. Also, I teach some students. I'm a mentor at Harvard. Students from all across the campus at Harvard, mainly master's and PhD students at the School of Public Health. But I would hope that really everything that I do creates that, all of those senses, because so much of what I'm hoping to do is to improve health. And we know very, very clearly that when people feel like they're accepted, they feel like they're not being judged, they feel like they're warmly welcomed, that they can genuinely be themselves. And
Mm,
I want people's strengths to shine. I mentor a lot of people. I've mentored dozens and dozens, a lot of foreign trained physicians, a lot of, yeah, people from really all over the world. I speak a few languages, so that's very helpful. Here in Canada, we have, of course, a lot of people from various parts of the world. And so to make people feel like they are going to shine, that they found a place, that they've arrived in a place where they can feel like they're safe,
mm,
wanted, and welcome to connect and make new friends. And I love it when people make new friends.
yeah.
Yeah, yeah.
One of my favorite things, like I'm a big people watcher. That's one of my favorite things to do when I'm in public. Like if people ask if I would rather go for a walk, if I am going on a walk, I would be watching the people around me. And it brings me so much joy just to see humans interacting and living their lives. Like there's nothing I love more than watching like people be in love in public.
Oh.
Um, I think that's just, it really shows their individuality and, the world can be a very scary place. And just seeing that reminds you that there is still so much good out there and it lives within everyone from anywhere. So I think that that individuality piece is something so important. And, in your work, you've mentioned a couple times that you really want people to express who they truly are. And, that is something that we really strive to do here at Love Caravan. And a way for people to do that is through acts of expression, you know? And honestly, anything can be turned to an act of expression. Even us having this conversation is demonstrating that we are able to express our thoughts and our feelings and connect with other people about them. Um, and that just shows the beauty of people being able to just be people and connect with one another.
Mm-hmm. And it's actually one of the solutions to the world crisis in mental health. When we
You
can
know,
create communities, when we can fully embrace everybody's expressions of self, when feelings of romantic love or maternal or paternal or filial love, when we can really love each other with our full hearts open and feel absolutely welcome to be in love, always first being love with self, loving self first, filling our own hearts brimming with love. And it's from that place that we then can be the most romantic of lovers, or the most loving of siblings, or the most adoring daughter or son or non-binary child. Yeah, I feel like that's, in the end, that's where we want to be. And from the yogic perspective, that whole idea of love, it's our heart, our anahata chakra, which is in the center of the seven. We have seven chakras, seven wheels, as we say in Sanskrit, and the center one is the anahata, the heart chakra. And so our practice, our yogic path, is so much about learning to be centered in the Anahata chakra, that green chakra, the Mother Nature chakra. Yes.
I would love to take one of your yoga classes because even hearing you talk about I don't even know how to say with that gorgeous accent. I always call them the chakras.
Yes. Yes.
Even you talking about the heart chakra. I've taken a couple yoga classes, but I wouldn't call myself anywhere near an expert. But you definitely have that voice that's very soothing and makes people want to open up. Like I can definitely see why you've made so many friends, you know, traveling across the world teaching these classes. I would love to take one of your classes. If you're ever on my side of the pond, I'm definitely going to be attending that ASAP.
Oh, most welcome. I love that, Piper.
Perfect. I wanted to touch quickly on mental health since you brought it up, and I wanted to know some specific examples of how mental health promotion and encouragement among the working class of women has helped integrate this personal aspect into your research and advocacy.
Yeah. So I did my master's thesis when I was in Northern England on the topic of mental well-being for working class women. And I was at the University of Manchester, and I was doing my master's work in Salford, which is a working class city. And the women I had the privilege to work with were mothers of adult children. They had been diagnosed with mental illness, usually depression. Almost all of them had been diagnosed with depression for something like 20 to 25 years. And at the time, the only thing that their physicians knew to tell them was to take mood altering drugs. And so virtually all of them had been on mood altering drugs for a fairly long period of time. And most of them had felt like they were able to get through the difficulties of their lives. They lived fairly painful lives in many ways. Poverty induced hunger. They didn't always have enough food on the table, and a lot of violence that they lived in their own homes, usually at the hands of their spouses, and many other forms of microaggressions and macroaggressions. And so the drugs were able to numb some of those pains that they experienced, but they didn't get to the root cause, which was a deep longing for connection and acceptance and love and um, and real togetherness and real justice and fairness. And they found this community development project, which was run by two community development workers. And that's where I ended up doing my work. And the two community development workers brought together a group of women, a large group of women who were all in that same kind of a situation where they lived in poverty, their children were grown up, they felt even more lonely now, and they were still on mood altering drugs. And
Mhm.
so slowly, through talking in a peer setting with each other about things that they didn't normally get a chance to talk about the pain of being violated, the pain of being beaten, the pain of not having enough food, the pain of living with an alcoholic, all of those kinds of
Yeah.
things. Talking together helped this group of women to realize they weren't alone. And sometimes that's one of the most powerful forms of healing, when we realize we're not alone. That feeling of deep isolation and aloneness can be one of the most frightening and discombobulating and painful things as humans can ever experience. So when they recognized that they were now together, that they had a peer group, that they could do this with the help of other people, they slowly, and this was not an instant process, but they
Hmm.
slowly found other ways to take care of their mental well-being. And all of them got off the mood altering drugs. They started doing breathing, listening to music, doing some stretching, light yoga, some light dance movements, things that got them into their body, in touch with themselves. This idea that the body is dirty, they were able to throw that away. This idea that they weren't beautiful just because of whatever the societal kind of messaging that was very patriarchal, very classist, all of those things that had gotten to them. They were able to throw those things away because they were doing this together with the help of these two wonderful community developers. And so by the time they found me, they wanted to tell their story and talk to somebody. So I was able to document it. Yeah, it was a very, very powerful and beautiful experience to see that even fairly advanced depression can be completely reversed.
I love that. And I think it is so relevant to what a lot of young people are going through today, with the feeling that they need to turn to these mood altering drugs to help pull them out of that deep repression that they were in. That is a different way to look at depression. But when you're just deeply so repressed where you can't figure any way to get out of it. And I think that is a really good point, a great point that you brought up, that there are so many different ways that you can actually help accommodate those feelings, whether it's with dance, whether it's with music, whether it's with creativity, if you're a writer, a painter, whatever it is. But I think one of my most favorite topics to write about is about relatability. And what you said about just feeling like you are not alone, that there's someone else going through that exact same thing. That relatability aspect is the biggest one that'll help you overlook it, because if you are looking at another person and you give them advice that you aren't taking yourself, but so many other people around you are feeling that exact same way, maybe you'll start to take your own advice, because that's our hardest thing to do. A lot of people, it's, especially for myself, it's easiest to talk about how other people could potentially get out of their situations, but I'm not going to do that myself. I'm just going to deal with it. But when you were surrounded by all these other people, you're like, you know what, maybe I should look into myself, and maybe I should take my own advice. Maybe I should use this relatability in a positive way to help myself. And, I think that is such a useful piece that our audience and anyone else that this discussion can reach, can benefit from.
Mm-hmm. Mm-hmm. Yeah, we now know that virtually every chronic condition is reversible. Using those forms of creativity and connection with body and movement, we know that food is profoundly helpful. Connecting with a group, the peer support is now an evidence-based way of reversing chronic conditions,
Yep.
and stress reduction and sleep. So people who experience mental health conditions often have a sleep pattern which is not conducive to positive health. Going to bed really late, not sleeping well, feeling nervous while they sleep, or sometimes with a deep depression, sleeping for 14 hours, maybe 16
Mhm.
hours, a very, very long sleep, and maybe not really wanting to get out of bed at all. We know that mental health imbalances cause a lot of sleep disturbances. So sometimes really focusing on how to change sleep patterns is the number one thing that people need to learn how to do. Getting into bed at an hour, maybe closer to 10 p.m., 11 p.m.,
Mhm.
sometime before midnight, and trying to get out of bed sometime maybe at 7 p.m. or 7 a.m. or 8 a.m., so that we start to have some regularity in our sleep patterns. And particularly say the university age group that you might be referring to, the 20s, the early 20s age group. Your generation has been hit really hard by COVID. The pandemic was a devastating, extremely high impact um, episode in your life, and that this is now a time to heal from that. I've witnessed a lot of people in your generation struggle like I've really never seen before. So this is a time to be very kind to yourselves, to not blame yourselves, to be able to look in the mirror and be very forgiving of whatever happened, whether it was addictive behavior, whatever kinds of behaviors came on during the pandemic. You might not have felt it was particularly adaptive, but you did it anyways. Just to be very forgiving about that and just to move on.
Would you say that this is something that this group that I'm a part of the general public, is often overlooked?
Oh yeah. Yeah, we talk about the crisis in children's mental health, and of course, COVID. We talked about the elderly, and that was another tragedy. We don't treat our elderly well in this part of the world, and so many died from completely preventable causes. We're warehousing our seniors, and so we were able to uncover the lid on a lot of truly discriminatory ageist practices. And I feel like, yeah, the late teens, early 20s, or the 20s and 30s sort of age group was almost ignored in the public discourse, and yet so heavily impacted. I saw it so much close up. And so I feel like this is a very, very, very important conversation,
Mm.
giving yourself permission to just be able to understand what happened to you during that time of isolation, whatever you did to get through it, often might not have been a particularly adaptive or healthful kind of a practice. And to be able to forgive yourself, move on, and then slowly just try to get back to being in a place of balance.
No, I love that. And this connection to both this senior and youth discrepancy that both groups struggled with during this time of the pandemic. Could you dive a little bit deeper into the intergenerational connection here? And in your experience and in your research, what do you have to say about this topic?
We live in a world in which certain groups of people have a lot of power and money. And those people, this is really counterintuitive. Those people typically have better mental and physical health.
Hmm.
So in Canadian society, those people are typically middle class, highly educated, cisgender, heterosexual, and we live in a world which gives men a lot more privilege than those who identify as women. So anybody who I didn't mention, that means immigrants, people of color, refugees, transgendered, non-binary, non-gender conforming, younger people, people without money, um, really, a huge swath of the Canadian population will then struggle with mental and physical health. And so what we really want to do in the field of public health doesn't sound like health at all. We want to create a society which is more equal and fair for everybody. So we want to lift everybody up, particularly those who haven't had a good deal. And then we also want to distribute income better. So
Yeah.
money and power are the two things in our society which make the biggest difference to
Yeah.
improve. And we've done many experiments over the years, just giving people money, people who didn't have enough money to take good care of their shelter needs as well as their nutritional needs every month, just giving them enough money to do that. We can measure that it improves their health. So now getting back to your question about that intergenerational challenge that we saw during COVID, we saw elderly people and young people struggling a lot. And what COVID did was revealed things which were poorly done already prior to the pandemic.
Yeah.
Showed us how much worse they could already get.
Hmm.
So did we treat care aides well, the ones who were working in our care facilities? No, not until we realized that all of us needed them to be
Yeah.
taking care of our grandmas and our grandpas.
Hmm.
And the conversation about care aides only came about because we saw that they weren't getting paid properly. They were going from care home to care home because they weren't getting benefits, or they weren't even getting decent PPE, or they weren't getting really enough money to survive on. And thankfully, that's one of the good things that happened during the pandemic, was that we had national conversations about taking care of the caregivers. And we also had national conversations about ageism and about the way that sexism, particularly for elderly women, works, because a large number of our elderly are women, partly because women live longer. And elderly men, of course, there's really a huge amount of ageism for elderly men and elderly trans and elderly non-gender conforming people as well. And I feel like we also talked about children, particularly in schools. I did a lot of CBC open radio shows as a public health expert during the pandemic. So I heard a lot of the pulse of what people were thinking about and who was vocal enough to call the radio station. And so I would say again that the one generation that we missed was yours, the 20-somethings and the 30-somethings. We didn't talk a lot about that particular demographic, but we did talk about people younger than you. And then the people in their 40s, 50s, and 60s, I feel like many, I mean, this is a huge generalization for which we will find a gazillion exceptions. But people who were more settled, were already in a coupled relationship, had good shelter security, were able to work from home. Money was the shield for a lot of things and got through the pandemic. Okay, they had social support, they had love, they had money, they had food, all of those things that we really need to survive. And yet people who are struggling to pay rent, again, the 20s and 30s something, in the expensive housing markets that we live in our country, they struggled and they were not stable. So they were running back maybe to live with mom and dad, or they were still trying to pay rent somewhere else. But living like on Zoom in a bedroom somewhere, really isolating, getting
Yeah.
through university on Zoom, terrible way to graduate from university if you're on Zoom.
And even high school. I know because I graduated in 2020 from high school, and I finished high school on Zoom, and my first 2 years of university were all on Zoom. And I was one of those individuals that was living alone in my apartment in a new city I've never like experienced. And it was definitely a very hard time in my life. And I know that I am so much more privileged than most people my age. So I can't even imagine how horrible some of the situations would have been for other people going through and feeling the same way I did, because it felt so hopeless. And, I've never actually heard someone bring up how our group could have totally been marginalized and left out of the conversation until you just mentioned it. And it's completely true. And, that's a major point in a lot of people's lives. So I think that bringing awareness to this issue is something very important for everybody to talk about.
Nice. Well, during the pandemic, I started a program called Wellbeing Convened during COVID-19, and it was for the university community that I'm part of at UBC, the Faculty of Medicine. And we wanted to do two things with our program. We wanted to teach people some well-being tools. And so that was things like learning breathing. I taught a session on eye yoga because we were on screen so much and our eyes were getting so impacted. We had one of our psychiatrists talk about sexuality, the importance of intimacy. We had people talking about mental health first aid, how you take care of your mental health when there's a bit of a crisis, lots of things like that. And we did it for the university community, so the students, the staff, and the faculty together. And the other aim that we had was to try to build some community, even though we weren't together, but how could we still build community online? And so a lot of us did recognize that that was a need during the pandemic and tried to do some things about it.
I
So
agree. I think that it's very important that we keep working on this online aspect, especially afterwards, after the pandemic and everything happened, because it created a new way for people to be accessible. That is why we started doing a lot more programming on our show where it is online. Even the show is online, so it can reach more people. And I think this would be a great time to segue into a performance that someone has put together for us. They are also from this youth group from another side of the world, doing an instrument that you've probably never heard of. So I'd love to cue that performance and have them introduce themselves. Alex?
how exciting.
I am a musician from Zimbabwe, based in the UK. And today I'm going to be playing the marimba, which is a traditional instrument from Zimbabwe. And the piece that I'm going to perform is entitled Hande. Hande just means let's go. And I do hope you enjoy. And thank you for having me here.
Oh, that was fantastic. So, Tawanda was actually a performer from our Caravan of Talents campaign we did last year. And yeah, he's from Zimbabwe. Isn't that just fantastic? I've never heard his instrument before meeting him last year. But I thought this was a perfect one to bring to you today since you've traveled the world, probably heard so many different instruments.
Oh, thank you so much. I love the marimba. And what amazes me is that when we were in Guatemala, they also play the marimba. So it's one of those instruments that has really gotten around the world. And on Saturday, the organization I founded, Maternal and Infant Health Canada, is hosting a well-being event based on a paper that I wrote about the health of racialized women, Black, Indigenous, and women of color in Canada. It's a well-being event that's going to have a Zimbabwean musician playing at it. So
No
this
way.
is perfect. Yeah.
That's
Yeah.
awesome.
Yeah. How synchronous is that, huh, Piper?
Hey, it was like written in the stars. What can I say?
Right?
So, for our next segment today in our interview, we have put together a little sort of game, interactive, what have you, that the audience can get involved with. So everyone that is watching, please feel free to join in, ask some questions, have some comments. I am watching both chats for our amazing guest audience members who are some high school students from New York, and for those of us watching in the YouTube chat. So let's get right into it. Our show is called, or this game show is called Advising Ailments. All right. With more and more Asian women facing PCOS and other conditions like PCOD, what are some suggestions you have for them to remain healthy, considering your expertise in yoga? And how do you pronounce this word?
Ayurveda.
Ayurveda.
Yes. Yeah. So yes, there are a lot more conditions like polycystic ovarian syndrome and other conditions affecting people really around the world. And India, I think, probably has almost like a pandemic of PCOS. So let's just look at one element of this. Let's just look at stress. Now, we live in a world where the potential to live in a high stress place is very high. Things like eco-anxiety can take us to a place of feeling very, very stressed. And the concern, particularly with PCOS, is in the reproductive age, that people are not going to be able to reproduce. And so being able to do practices like yoga, and I'll talk about Ayurveda next. So yoga helps us in many, many ways to reduce our stress. Firstly, it helps us learn how to breathe. So the breath practices in yoga, the first ones we do, we just typically call them baby's breath. They teach us how to be like we were when we were a baby, just to be able to breathe fully and exhale fully. And so much of the relaxation comes in that exhalation, because sometimes we actually breathe in a little bit more than we need. So the yogic practices, which teach us how to breathe and really let things go, are very, very, very important. What happens to a lot of people in their reproductive time area, if they feel like they're not able to reproduce, is that their entire world gets focused on that one thing. I need to have a baby. And there is nothing more important than having the baby. So if you have a condition which could potentially preclude you from getting pregnant, then doing everything you can to treat it is really important. So besides yoga, there are a large number of other practices. Shavasana would be one that I would recommend for almost everybody with these conditions and other conditions. Shavasana is the position where you basically just lie like a starfish and you relax. And in my classes, I can teach a Shavasana for about 20 minutes. And what happens then is that the whole body system, almost every organ, gets a chance to really rest if you're doing it in a way that allows you to get to that place. And so coming to that kind of a Shavasana place where everything is very soft and deeply relaxed can be very, very rejuvenative for the body. And it's from that place of rejuvenation where we can heal from different conditions. So from the breathing to Shavasana to some light asanas. And then of course in yoga, there are practices of meditation, dhyana, as we say. Dhyana, which is the seventh limb on the Ashtanga, or the 8 limbs of yoga. So doing meditation is also very, very, very helpful to focus the mind, to calm the mind, and to really figure out what's important here and how you can get the help you can get. Now, Ayurveda, I don't know what the published research says about Ayurveda. Because I am writing the UNESCO's high-level technical piece on Ayurveda right now, I can tell you that it's unlikely to be a lot of medical literature on the treatment of these conditions using Ayurveda. And I can tell you that at the same time, research is often not up to date with clinical treatment in any system of medicine. So I believe that some of the detox practices in Ayurveda and some of the herbal treatments in Ayurveda might be helpful for treating these particular conditions. I wouldn't be able to say with any certainty because clinical evidence isn't something that I know beyond like a few cases. And so I wouldn't be able to say much more about Ayurveda. But these are the kinds of conditions which we are seeing more of. And really, it's the same 5 things that make a difference to almost every condition: nutrition, exercise, stress reduction, sleep, and good social connection. So from a kind of a holistic framework, following those 5 things, and that means looking up the foods which are good for your particular condition, and then eating them. So there's often this huge disconnect between what we know and what we think we might be doing and what we're actually doing. So it's a second, and it's a big step to actually start eating those foods. And then if you know that taking a walk for an hour a day, just as an example, is a good thing for you, then actually doing it, getting up, going for that walk, right? So moving your body is really, really important. The sedentary lifestyles that we tend to lead are part of the root cause of our problems. So addressing that, those 5 things, yeah.
Perfect. We had a guest ask, sorry, I had an alarm go off. We had a guest ask, what are your opinions about homeopathy?
Oh, well, homeopathy is a fairly old system of healthcare. It's often credited to Samuel Hahnemann, who was a German early homeopath. And yet, other people would say, and I believe they're correct, that homeopathy actually started in India. You might not know that the late Queen of England, the one who just passed on September 8th, 2022. I know that date very well because my father passed away on that day, so I know that date very well. She would travel with her homeopath. At least that's what the lore is, that she had a homeopath. In Europe, homeopathy is not quite so poo-pooed as it is here. People here will remember that the CBC did a marketplace investigation on homeopathy some years ago, quite a while ago now, maybe a decade or so ago. And that really crashed the whole worldview of homeopathy as pseudoscience, as this absolutely ridiculous practice. And yet, if we are willing to open our minds and think about the possibility of what is energy, and then we start to understand what homeopathy is, because most people who practice any kind of science, any scientist will say, it really doesn't make sense that the lower the dose of something, the more potent it can be, because it won't make sense within a particular paradigm. Those of us who are genuinely interested in improving health for people around the world have to be open to understanding various paradigms of health and healing. And so understanding homeopathy is not something I've spent my lifetime doing. I wouldn't be able to explain it to you at a very granular level. But what I have been made to understand is that homeopathy is under the branch of holistic practices, which would be largely classified as energy healing. And so if you believe that there is something called prana, which is a Sanskrit term, or chi, which is the term in traditional Chinese medicine, or ki, which is the word in Japanese, or mana, which is the word in Hawaiian, and there's 47 languages around the world which believe in this life force. So if you believe in that, if you believe that that exists, even though you can't smell it or grab it or taste it or measure it, right? If you believe that that exists, as many practitioners in Canada do, then you would be open to thinking about homeopathy as a potentially viable form of healthcare. If you can't come to that place, then homeopathy is probably just garbage to you. So that's a very short, long answer to what I think about homeopathy. I hope that's helpful to you, my friend, whoever asked it.
Yeah, that was Devani, actually. We have a couple more questions, but we are going to have to cut off our interview here soon.
Okay.
Let's do one more question from the audience. Actually, we have to do our relay. There are just so many amazing questions. Maybe we'll have to do a part 2 to this interview later on. But we wanted to ask you if there was anyone in your network that you would like to nominate to be a part of our interviews coming up, whether they are from the youth realm, a woman empowerment, someone in philanthropy. What are your thoughts on that?
Oh, let me think about who I would nominate. But do you want me to look at this question that you got on the screen and talk about that?
I wish I could, but we are
Are we out of time? Oh, okay, so we are actually out of time. Okay, so let me think about the nomination. And are we wrapping up to say goodbye now?
We will, but let's hear this nomination and then we'll do a quick little group picture and then do a send off. I wish we had all day. I've been having an amazing time in this conversation and so many just intriguing topics that I think need to be brought more attention to.
Fabulous. Okay, so you want me to nominate one person who can be?
Who could potentially be a guest speaker that we have on the show in the future.
Ah, right. Okay. I don't think I should say it on air yet because I would want to check with the person. Is that okay? Can I send that to you? Because I would love to. I would love to give it some more thought. I have lots of people who I think would be amazing. And I'd like to just give it a little bit more thought and maybe not say it publicly until I've checked with that person. Would that be okay?
That is completely understandable. Time just flies and we'll stay in close contact, and maybe we could have you be another speaker in a different episode, but also if you were a guest audience member for someone with a related field of work, that'd be fantastic. I wanted to end off with a little picture, and I noticed that you already knew how to use the virtual filters and avatars and whatnot. So I think we should put on something fun just to end it off. I think I'm gonna be this little unicorn.
Okay, sounds great. Okay, sure, I can do that. One of those too. Let's see. What's that one? I haven't seen this one yet before. Oh, it didn't come on. Let's see that one. Oh, that's not so exciting. No, that. Let's see. Oh, here's okay. I love these ones. Okay, I'll be a bear.
Oh, perfect. All right.
Okay.
Click virtual picture. All right. I want to thank you so much for coming on the show today and being just a wonderful guest. I had an amazing time. I wish I could talk to you all day. I'm going to have to get the deets on that yoga class so that I can attend. And I hope our audience members enjoyed today's show. Thank you so much for being here, and I can't wait to